Okay, the recording has started.
Perfect. Good afternoon, everyone. I'm Lisa Emerson. I'm a Senior Policy Advisor for the Division of Financial Regulation, and I'll be leading the Prior Authorization Rulemaking Advisory Committee. We sent out an agenda, and we'll have it also here on the screen, a copy of the House Bill 3134, the law, as well as a set of draft proposed rule amendments. And also the statement of need and fiscal impact document that we do along with rulemaking. And those will be kind of the main things that we discussed today. We are hoping, or we have planned for this to be a one RAC only, but we certainly can have another one if needed, depending on what we talk about today. I will be we'll go ahead and do introductions here in a moment, as well as we'll start with some housekeeping. So, just customarily, if you're not speaking, would you please be on mute so we can reduce that background noise? And when you'd like to speak or comment, if you could just please raise your hand and then we'll call on you in order. The initial meeting time is really for the time for myself, RAC members, and DFR staff to converse. And we will have a time period for public comment on the agenda. If some of you have your subject matter experts joining you, especially for the insurers, you certainly can, phone that friend and have them, ask a question during the general discussion on your behalf. So with that, I introduced myself. So why don't we start with brief introductions from the DFR staff that were able to join today. Maybe we'll start, everyone I think knows Karen, but Karen, why don't you go ahead and introduce yourself?
Hi, I'm Karen Winkle, and I'm the division's rule coordinator.
Great. And maybe next, I think we go to, how about Mark?
I am Mark Rivers. I'm a data analyst with the Division of Financial Regulation.
And then how about we go next to Colette?
Hi, Colette Hittner. I'm with the PBM compliance team with Division of Financial Regulation.
Thank you. And then I think next is Spencer.
Hey everyone, Spencer Peacock, part of the business analytics team here at DFR.
Thanks. I think I got everyone, but did I miss anybody with DFR team? Okay, next we'll go to, I see someone calling in on a 503 area code phone number ending in 3308. Would you please go ahead and introduce yourself?
Hello. Hi, this is Betsy Boyd Flynn on behalf of the Oregon Academy of Family Physicians.
Thank you, Betsy. Next we've got Melanie with United Healthcare.
Hi, this is Melanie Anderson, Associate General Counsel with United Healthcare.
Welcome. Next is Antoinette Cambia.
Yes. Hi, good afternoon. My name is Antoinette Iwachi, and I'm the Senior Public and Regulatory Affairs Specialist for Cambia Health Solution, also known as the Regents Blue Cross Blue Shield of Oregon Health Plan and Brisbane. Thanks for having us. Thank you.
Thank you. And next is Charlie Fisher.
Hi, Charlie Fisher with OSPIRG, Statewide Public Interest Group. And I don't think I received the agenda, so if you could send it to me with the documents, I'd appreciate it. Thank you.
Sure, will do. We do have it displayed here too, but yeah, we'll get that sent to you. Next, Courtney Johnson.
Hi, Courtney Johnston. I'm a Senior Director with Government Relations with Health Net of Oregon, Centene Plans.
Thanks for being here. And next is Courtney Dresser.
Good afternoon. Courtney Dresser, Vice President of Government Relations for the Oregon Medical Association.
Thank you for being here. And I see next is Gary Frey, F-R-E-I, if I'm saying that right.
Yes, it's Dr. Fry, Gary Fry. I'm a physician reviewer for Cambia Health Solutions.
Thank you for being here.
You're welcome.
And Next is Gary Holliday.
Hi, this is Gary Holliday with Pacific Source Health Plans, Director of Compliance for the Commercial Lines Business.
Thanks, Gary. And Merlene Converse.
Hi, my name is Merlene Converse, and I'm a government relations consultant for Kaiser Permanente.
Thank you for being here. Michelle Baird.
Hi, Michelle Baird. I'm also with Pacific Source Health Plans. I'm a senior compliance specialist.
Welcome. And next, we've got Bo Wrights.
Hi, Bo Wrights, a government affairs policy analyst with Providence Health Plan.
Thank you. And then Rick Blackwell.
Hey everyone, Rick Blackwell, Director of Oregon Government Relations for Pacific Source. I'm just kind of a member of the public today.
Okay, thank you. And last but not least, Scott White.
Good afternoon. My name is Scott White. I'm the Director of Regulatory Affairs for Moda Health. Happy to be here. Thank you.
Thank you for being here. Yes, thank you, everyone. So we have, a considerable amount of time on the agenda, and so we'll just kind of get going with things. But I do want to preface for everyone that's here today that you may have been wondering or have a question as to why we've only drafted proposed rules for Section 1 of the bill. The reason for that is that we feel that we're only proposing rules for Section 1 at this time because Sections 2 and 3 of the bill are quite specific and appear clear enough that we don't think rulemaking may not be needed. Where the Section 1, there's been significant amendments to the data reporting elements, and we want to ensure that there isn't tension between our current rules and that those are in alignment with these new reporting requirements. So that's why we're focusing on Section 1. But we're definitely open to feedback from RAC members, questions, discussion, anything we need to consider for other sections of the law, Section 2 and 3. So I thought I would, get that, if that was on your mind, kind of that question answered readily. I do have a copy of the bill that was sent out to you of the House Bill Enrolled 3134. And we'll be focusing on Section 1 first, and then we will get to the amendments to Section 1 and the proposed draft rule amendments that will help us align with that section. And then we can discuss Section 2 and 3. So you have that available. It was sent out to you for your reference. But with that, I think we could probably go ahead and just get on to looking at the draft rules. Do you want to bring those up, Karen? Okay, so the main rule that we are proposing to amend is, Oregon Administrative Rule 836-053-1070. That has to do with the annual data reporting by insurers on grievances and prior authorization, and what is that format and content. And so our existing rules definitely, had brought over the data, prior authorization data elements into the rule, and those have changed in the law. So we want to make sure they're in alignment. We had an internal discussion with the data team and the manager of that data team about what we currently have in existence for for the data reporting elements that are in this rule. But the main thing that changed is the data metrics for prior authorization reporting, and the timeline has been changed. So now we also need to publish that data, make it available to the public on the website as well. So we are under a different kind of a deadline and a timeline, but we felt that we would like to leave the data reporting for grievances and appeals, including external review, as they are currently. That data is due as required by ORS 743B-250 on or before June 30th, and we want to leave that as is. So the amendment to this, Section 1 here is to just, break it up. So grievances and appeals are on one line, and that they will be reported out by on or before June 30th for the previous calendar year, ending December 31. And then we've added to carve out to comply with the requirements of the new law, House Bill 3134, which will have a law chapter. I believe the law chapter did come out is 388, but I'll make that change in the future. But that on or before January 31, we're proposing of each calendar year, insurers will report the information that's required for prior authorizations for the previous calendar year. And the reason we are proposing January 31 is because we need to be able to publish this information by March 1st. So the data needs to be gathered, validated, and posted. But we are open to questions, from RAC members, those that are going to be doing this work, especially the insurers, if you have any concerns with that date. Yes, go ahead, Scott.
Hi, Lisa. Not a date concern, just a couple clarifications that I want to make sure I'm understanding. So we're basically, ORS 743B.250. I think that correlates to what's on the website is the patient protection reports. And previously it included grievances and PAs. So now that's been changed to now that would be grievances and appeals, and that will stay June 30th as we're used to from an issuer standpoint. And then a new report of PAs for the previous calendar year, 131 annually. So with that, I want to clarify, is it PA auths received or completed in the previous calendar year? Because you could have some overlap there where something's received but not completed. And I thought that might be an important distinction to add to this verbiage if it's not going to be somewhere else.
Yeah, I think those instructions are usually provided on the data reporting form, to those clarifying elements, but I'll make a note of that and we can come back to that because that's a good question that you raised.
And I'm assuming, but I don't like to assume, so I'll ask for clarification, Lisa. On first report would be due 1/31/26.
Yes. Yeah.
Okay.
It would be for the upcoming new year, which will be here
you.
before we know it.
Yeah, no kidding.
Yeah.
Appreciate it.
Yeah. And then of course, C, I had to just kind of reformat this section that is remaining the same because the format and the manner will be as described on the division's website with the reporting template that we have and the instructions for filing that information. Then some renumbering here. You can go ahead and scroll down, but I think I missed a hand. Antoinette, do you still have a question?
No, I think, Scott, basically we're on the same page in terms of the questions. But I guess, going back to B, since it appears that we will be reporting based on the prior calendar year, so it's going to be, and I'm talking about the 2026 report, so it's going to be based on January 1st, 2025 to December 31st, 2025, correct?
Yes.
For reporting that's going to be due January 31st of 2026. Yes. I'll go back and talk to my people, but it just seems like it probably may make more sense if it's based on the PAs that have been approved to date, just because of that quick turnaround time to get the reported in by January 31st. But again, I'll go back to my people and ask.
Okay.
But something to think about here. Yeah.
Yeah, no, I've made a note of that and I'll talk to get clarification with the data team because that's a completely reasonable question to ask. So. All right. And we're definitely open to, taking that back to your teams, talking about the date and then, following up with us with comment. Okay. So let's go ahead and scroll down further. I didn't make any other amendments to the other aspects of the current rule here until we get to the actual data metrics. Oh no, I did do an intro. So I've revised sub 6, paragraph 6 in this section of the rule. We thought it would be helpful to bring the definition from the law, from the bill over into the rule regarding the definition of standard and expedited So it's just bringing that over for clarity and continuity as it leads into a new section 7 actually that goes into the data metrics that are being removed from the law and then being added by the law. So the prior authorization data elements, increase to, there was 1, 2, they've increased the elements and removed these past data metrics. So we are, as an internal, team that have discussed this, feel that we can, shift to these, what's now in the law, and I numbered them, A through, can you keep going through H? And those are just coming straight over from the bill language on the law. And then, of course, updating the statutory authority with the new law information. So these rules are pretty straightforward. And as I mentioned before, and for anybody that may have joined after, we're not proposing any draft rules for section 2 or 3 of the bill. We feel like this is important to open the rule. The bill doesn't require us to do rulemaking, but we felt that it's really important that our rules align and don't conflict with the changes in the law and the amendments to 743B 250 that were in the rule. So let's take a look back at the bill, Karen, the actual House Bill 3134 language, and let's go to section 2. Okay.
Sorry, did I
keep going?
Okay, keep going. Okay.
Yeah.
There it is.
There you go. So again, we're the divisions of the opinion that we are not perceiving there to be any need for rules to provide clarity for what's in the law related to the section 2 new provision that the surgical procedures identified during a surgical procedure that has already been pre-authorized or received prior auth. They don't need to request prior auth midstream. However, there would be obviously the other parts of our regulations that have to do with, is it a covered benefit? Those things like that. There would be a process for that should there be any issues that arise from that procedure, like if it's, say, investigational, that kind of an issue. So there's that. I'm happy to take any questions or comments that you might have, or you can certainly follow up with any written comment if something that you perceive may need further clarity. And in section 3, this again, we feel is straightforward. It's pointing to the federal rules for the application program interface requirement that will be used for prior authorization by health benefit plans. And that is, I think, help me refresh my memory, but I think that is starting in 2027. Yes, Courtney, please go ahead.
Thank you. Yeah. I think in section 2, I get why there's no rulemaking. Section 3, though, I'm wondering how we put a pin in this, in the sense of I think future rulemaking might be necessary for a couple different things, and I love and on the insurer side too, because it's not something we really talked about during session, but if things kind of continue, if the program at the federal level kind of goes away or whatever happens, this is still here in Oregon law, and we'll have to figure out a system. And I know a lot of insurers are already moving in this direction, whether there's a federal law or not, or federal rules or not. But I do wonder if there would be a point where we would need to take some of the federal rulemaking that was done and put that into Oregon rulemaking in some form or fashion. And because the federal rulemaking is not for all commercial state plans and things like that. So I do wonder if this is something that needs to be done in the future before the implementation date.
Okay. Thank you for raising that. Because I actually thought about it as well, but I figured we had a little time, potentially. And I have seen, I think some other states may have gotten ahead of this and put some of it into their rules. I think Colorado is coming to mind. Not sure about Washington, but yeah, I'm interested in other people's thought, other RAC members' thoughts about that, especially like from the insurer's point of view. Yes, please go ahead, Antoinette.
Yeah, I think given that, we just did find out that this rulemaking is only focused on section 1. But with section 3, I mean, I will advise the DFR that if a majority of RAC members are steering towards having some form of rulemaking to just make sure that both industry and the DFR are on the same page. Although this is operative in 2027, I prefer that the DFR initiates rulemaking earlier, just to make sure that there are no operational hitches, with payer systems interfacing with the federal system. Yeah, so that's what I would encourage the DFR do. Let's not wait until 2020, end of 2026 to do this. Let's initiate rulemaking a little earlier. Thank you.
Thank you. And we'll first go to Scott and then to Courtney.
Yeah, thank you, Lisa. I guess it was my turn for Antoinette to cover the majority of my comments. The only thing I would add is you're correct. Other states have jumped on this, Alaska being the other one this session that are in the vicinity. I would support rulemaking. The rules are referencing one specific part of the federal CFR, and that federal rule is a lot larger. So just to ensure that providers, members have a consistent experience across insurance carriers, getting some of the DFR's expectations in alignment with this rule, I do feel would be appropriate. Again, this is a lift for issuers where IT teams are working on this to build these APIs and have FHIR standards met and things like that. So I think it is important to understand the scope of services here based on those federal rules that are being included as well. That's another thing that's differed by state. And so there are complications where it's not quite as simple in my mind of just referencing 45 CFR.
Thank you.
Thank you.
Courtney, please go ahead, Courtney.
Thank you. And this, for those who were in the lawmaking process, this was one of the hardest pieces of the bill. Drafting the bill was getting this something referenced correctly. And it took a lot to get it drafted in any form or fashion. I love it when the insurers and the clinicians are on the same page. I just want to reiterate, the sooner the better, probably, because and Scott just said it correctly about the experience. I think that the thought process on the clinician side is this sounds really good, but they're super concerned about how all these interfaces with all the different insurers that they all contract with will work together if they work together. So any way to kind of start easing the clinician, their minds and having them be part of the development and rulemaking and experience of this will be much, much better in the long run.
Okay. Thank you. And Marlene?
Hi, Kaiser Permanente, like many carriers, operates in multiple states. We have an interest in the API standards being the same across all of the states that we operate in, because when states create a one-off uniqueness, it significantly makes the programming more complicated. So we would be fine with pursuing rulemaking on this, but just being mindful that having it align with the federal standard is what we want to do, not to create something special just for Oregon. Just for consistency of national carriers, it's really important.
Understood. Thank you. Please go ahead, Gary. You went off, you're muted.
Sorry about that. Appreciate it. Just read it again. If Oregon starts doing customizations from the federal law, it's going to create problems for those insurers that operate in multiple states, which is what Pacific Source does. I just want to just give extreme caution to trying to do rulemaking ahead of the curve. I understand it's great, you want to implement it, but you're going to find some carriers that may disagree because you're going to be all over the place and spending a lot of time trying to meet each state's requirement.
Yeah, we haven't had a robust discussion about this, so I'll definitely be taking all these comments back. And if any of you who have mentioned other states want to offer any additional detail in comment, please do, pointing me to those sources. Like I said, I've looked at it a little bit, but welcome that level of detail in the comment. Yes, go ahead, Scott.
Oh, just to say that every state that I've seen it in has aligned with the federal standards, and I certainly was not pushing for special standards or that 100% agree with a standardization across multiple states with those standards. But just everyone I've seen has aligned with the federal standards, and yeah, certainly not pushing for a special Oregon process.
Thank you.
Thank you.
Yeah, that's what I recall as well. And as Courtney mentioned, and some of you may have mentioned, this is a heavy lift for everybody to be, ready to go by that time. So uniformity obviously will be very helpful. All right, anybody else? Okay, if we could go ahead and go back to the agenda. Great. So I mentioned when kind of introducing the agenda that we were really hoping this was going to be a one and done kind of RAC, but certainly have to, wait for some comments after the comment period, take all that information into consideration and have some more internal discussion. And if we decide, now is the time to do this, or maybe there'd be a window of time. We do have a special session coming up potentially. It would be the shorter session. We might have some room to do rulemaking, whether it be now during our prime season or not as delayed as our other cycle. I can't really make any promises on that. So just know that I hear you all, and I will definitely we'll take that back to talk as our internal rule group and discuss what we might need to do. Hey, Courtney, please go ahead.
Just a question, trying to remember how things work. You can reopen a section at any time. So you can reopen rulemaking on this at a later point. It doesn't have to be during the implementation period or whatever we're calling this, but you could always open it up and have. So we can have the Section 3 conversation even after it's all in, said and done.
Yes, exactly. Yes.
But still get the Section 1 piece done, so they know what to report in March or in January.
Yes. Yeah, because we are under a time crunch. We would only have really time to do, we want this to be effective January 1. And there's timing requirements for rulemaking that you have to hit certain deadlines. So I just don't know that we would be doing this piece right now. But I'm also hearing the concerns from the insurers that we don't want it to get too far down the road either. So I just need to have some time to think a little bit more about it.
Thank
you. So really what we have next is just an ask from me that I shared the kind of the draw. It's our template for this statement of need and fiscal impact. So at any time with your written comment or the public comment period, if anybody has any comments, some key questions on this SNFI, we call it, are how do these rules affect equity in the state? Does it affect certain populations differently, better? So feedback on that, and also any financial impact to small business is also a factor. So we welcome feedback for that document as well, which is part of the rulemaking.
Hey, Lisa.
Yes.
Lisa. Merlene has her hand up.
Oh, okay. Thank you. flagging that. Go ahead, Marlene.
Hi, I'm sorry. I just had a question. It has been a long time since I've participated in a RAC where we have had like a technical guide issued in the future. Lisa, could you talk us through like when when the DFR goes to create the new template for this report that will be carriers will be doing, what type of a review process is there for carriers to look at the templates and ask questions if they don't understand what is being asked for?
I would imagine that's, well, I believe that I don't want to like put the data team on the spot here that's with us today, but they're already talking about it and getting, thinking about the draft for the template, breaking the current template that we have, breaking that prior auth out so that it stands alone. And then they would be trying to get ahead of that because we do have the March 1st deadline. But thank you, Spencer, for rescuing me.
No problem, Lisa. You covered it very well, right? So it's a great question. Our goal is to be collaborative. One of the things that we will need to do is work with DFR management to determine what it's going to look like, and then from there work with you all. The beauty of this one is the rule is pretty straightforward, though many of you probably can recall very recently the prior authorization reporting changed, right? So this is throwing us for a little bit of a loop where we're having to just go back and redo. But our goal is going to be to share drafts, get draft instructions out to you. Some of the questions that were raised earlier are questions I have as well. So our goal is to be very collaborative and to move as quickly as we can, right? We understand that just because it's not due till January 31st doesn't mean you don't need instructions months ahead of time for your teams to prepare. That's going to take some work, right? And January 30th doesn't give you or us a whole lot of time to work on this. So collaboration is our goal. How that looks might depend on the number of questions we have, the number of questions we get from you, the feedback we get from you. We are always happy to schedule one-on-one conversations. That's something we've done in the past, and we can certainly consider that moving forward.
Thanks,
Thank you so much.
Thank you. That was a good question. So thanks for asking it and thanks for jumping in. Do you kind of have a tentative window of time that you think you might be a goal that you guys are striving for to have a draft template or be even ready to share such a thing? Like,
I would love to within a month or two. Right. I mean, we need to let some of the rulemaking play out and make sure there's nothing that's going to disrupt that.
Right.
Again, it looks pretty straightforward, but I would hope pretty quickly.
okay. And yeah, again, and taking comments would be appreciated about the new deadline or the timeline we have for the January 31st, because yeah, that will affect the goal for getting the template drafted and out. Thank you. Okay, so not hearing any more questions right now at the moment. Let's just keep moving along with the agenda. This is the opportunity for some open public comment. So if anybody who isn't a RAC member, but rather say an interested party, feel free to raise your hand and ask any questions that you might have. Please go ahead, Rick.
Thanks, Lisa. Rick Blackwell again with Pacific Source. Wanted to address my take on Section 3 of the bill. Okay. I think the fact that the CFR is so pinpoint, and as Courtney said, it was a real struggle to find the right reference during session to make sure that we were accurate. But I think that accuracy also means that we're kind of constrained in what we can do via rulemaking. I think the CFR is essentially the rule that we'll need to follow by the time 2027 rolls around. I think it would take further legislation to make any modifications if the API tends to change at the federal level. So I'm just throwing out my 2 cents there as a member of the public. So thanks.
Thank you. Appreciate it. Okay. Anybody else? Okay. Well, we reserve the time we think we might need, and sometimes we're done sooner. And this will give you some time back to think more about this. And again, we usually, as far as next step goes, probably would like to usually give at least like a 2-week comment period. So I am thinking it might be a little bit more than 2 weeks. And I was thinking that probably Wednesday, August 13th is probably a timeline that would work for me because I'll be out of the office on the 14th and the 15th. But that gives you a little bit more, just a little shy over the 2 weeks. Actually, no, I'll be extra generous. Let's say the 15th of August. And I can send a follow-up email to you all on this after our meeting today. So we appreciate those written comments by the 15th of August. And are there any, and again, I don't know if we'll be needing to schedule another RAC meeting or not, but I'll just be sure to keep you updated. And I really thank you all for being here today and for your time and contributions. And feel free to follow up with me if you think of anything after our meeting today. Thanks again.
Thank you. Thank you.
Thanks, Lisa,
Thank you.
Karen,
Thank you.
team.
Bye-bye.
Bye.